Hello friends and welcome back to our channel. We're going to discuss a very significant issue today, the early indicators of Alzheimer's disease that may point to the development of the illness. With Alzheimer's accounting for 60 to 80% of cases, this is the most prevalent type of dementia. Early detection of these indicators is essential for prompt assistance and intervention. Millions of individuals worldwide are impacted by this topic, either directly or by a loved one. Gaining the appropriate support and assistance can be greatly impacted by being aware of these early indicators. Now let's get started. Alzheimer's is a progressive brain disease that impairs thinking, behavior, and memory. Changes in the brain that result in protein accumulation and cell death are its defining features. While some memory loss associated with age is natural, Alzheimer's symptoms are more severe and cause problems in day-to-day functioning. The most prevalent type of dementia, which is a broad term for memory loss and other cognitive abilities severe enough to impair day-to-day functioning, is Alzheimer's disease. 60–80% of cases of dementia are caused by Alzheimer's. It's a progressive illness in which the symptoms of dementia progressively get worse over several years. But what are the early signs we should be looking out for? Recognizing these signs early on can lead to an earlier diagnosis and better management. Let's go through them one by one. Number 1, memory loss affecting daily life. A disruption in daily life due to memory loss is the first and most typical indicator. This can involve asking the same questions over and over again, depending too much on memory aids, forgetting freshly taught material, significant dates or events. While forgetting names or appointments on occasion is natural, Alzheimer's patients forget things more frequently and are unable to remember them later. A common symptom would be forgetting a close friend's name or a significant date and having trouble recalling them later. Number 2, challenges in planning or solving problems. Planning or problem-solving difficulties are 2 more early warning indicators. This could be difficulties paying monthly expenses or following a recipe that you are familiar with. Individuals may begin to lose focus and complete tasks far more slowly than they did in the past. For example, finding it difficult to follow the instructions in a straightforward recipe that they have used numerous times. Number 3, difficulty completing familiar tasks. Completing familiar duties at work, home, or leisure is the 3rd indicator. This can include having problems remembering the rules of a favorite game, maintaining a budget, or driving to a familiar place. For instance, becoming lost on the way to a location you visit often. Number 4, confusion with time or place. Alzheimer's patients are prone to forgetting seasons, dates, and the passing of time. If something is not happening right away, they could find it difficult to understand. They might occasionally lose track of their location or method of travel. Not knowing where they are or what day it is could serve as an example. Number 5, trouble understanding visual images and spatial relationships. Some Alzheimer's patients have problems comprehending spatial relationships and visual representations. Their inability to read, judge distance, and distinguish between color and contrast could make driving problematic for them. For example, misjudging the distance when reaching for something or having trouble seeing text. A word of caution: before making significant changes to your diet, it's always a good idea to consult with a healthcare professional, especially if you have any underlying health conditions or are on medication. If you like what you've seen thus far, please click the like and subscribe buttons and the bell notification. Thank you for viewing. Number 6, new problems with words in speaking or writing. Alzheimer's patients may find it difficult to follow or participate in conversations. They might repeat themselves or halt in the middle of a sentence and not know how to carry on. They may have problems naming a familiar thing, struggle to find the right words, struggle with vocabulary, or use the incorrect term. As an illustration, refer to a watch as a hand clock. Number 7, misplacing things and losing the ability to retrace steps. An Alzheimer's patient may arrange objects in strange ways. It's possible that they misplace items and are unable to trace back their movements to locate them. They might occasionally accuse someone else of stealing. With time, this might happen more frequently. For example, forgetting where their keys are after placing them in the refrigerator. Number 8, decreased or poor judgment. Alzheimer's patients may notice changes in their judgment or ability to make decisions, particularly when it comes to money. For instance, failing to maintain personal hygiene or handing up a sizable quantity of cash to a telemarketing. Number 9, withdrawal from work or social activities. Alzheimer's patients may begin to distance themselves from sports, hobbies, social events, and professional initiatives. They can struggle to recall how to finish a favorite pastime or to stay up to date with a favorite team. The changes they have gone through may also make them shy away from social interactions. Number 10. Changes in mood and personality. Alzheimer's patients can have mood swings and personality changes. They may experience disorientation, suspicion, depression, agitation, fear, or anxiety. When they are with friends, at work, at home, or somewhere else outside of their comfort zone, they could become quickly agitated. In social settings, they have been known to behave strangely. For instance, experiencing abrupt mood swings or growing wary of loved ones. Seeking medical advice. It is crucial that you visit a doctor if you or a loved one is exhibiting any of these symptoms. A diagnosis made early increases your chances of benefiting from therapy. It also offers a chance to make future plans. To determine whether symptoms are caused by Alzheimer's disease or another illness, doctors can perform a number of tests. These could involve neurological examinations, brain imaging, and tests of cognition and memory. Early detection of these symptoms is essential. Alzheimer's has no known cure, although early detection enables the following benefits: improved symptom management, inclusion in clinical studies, future planning, and access to support services. If you notice these signs in yourself or a loved one, consult a healthcare provider. Remember, occasional forgetfulness is normal, but persistent and worsening symptoms warrant attention. Early detection can significantly improve quality of life for those affected by Alzheimer's disease. Remember, recognizing the early signs of Alzheimer's can make a significant difference in managing the disease. Stay informed, stay proactive, and take care of your health. Thank you for watching. If you found this video helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Don't forget to subscribe to our channel for more health-related content. If you have any questions or personal stories, please leave them in the comments below. Let's keep the conversation going and support each other.